Hey everyone, and welcome to Chef AJ and Friends. My guest today is Dr. Matt Lederman, and we are going to be revealing the results of my lung biopsy. And if you're wondering what lung biopsy, I'll refer you to a link below for the lung biopsy I had on December 17th. I did a video when I got home from the hospital. And if you want to know why I had a lung biopsy, then watch the video from December 5th that I did with Dr. Matt Lederman, where I shared my diagnosis of stage 3 lung cancer with you. Before I bring on Dr. Matt, I first want to once again thank everyone from the bottom of my heart for the unbelievable tsunami outpouring of love, support, prayers, jokes, and now even gifts. I am doing my best to go through the over 100 emails that I receive every day and the help desk and the hundreds of texts. I will get there. Just please give me some time and just know how much it means to me, even if I haven't responded immediately. But I got to maybe I'll do a whole show where I just show all the cool gifts that you guys have given me, but I'll just show the ones that are on my desk today. So these bracelets mean a lot to me. Thank you, Jody Sampley. And even like when I go to my medical appointments, people just love these bracelets. And it just reminds me on days that I have none to have strength and hope. Rochelle Sirigliano made this doll for me. It kind of reminds me of a voodoo doll. It's like, kick cancer to the curb. Thank you so much for that. But let me just tell you about Disneyland. This is an update. So when I revealed that I had lung cancer, I was sharing that one night my husband and I were watching Emily in Paris, and I said to him, do you want to go to Paris? I mean, this is the time to do things we always wanted to do. And he said, well, not really. What do you want to do? And I said, well, I want to go to Disneyland. Little did I know then that there's a Disneyland in Paris, and I could have done both. But so many people have generously gifted me my Disneyland dream, and I do want to acknowledge them. So Tracy Villegas has sent me a one-day pass that I can include a couple of friends, and Lori Landry and Tim Bannock from Lori Landry Wellness, another one-day pass with one friend. So I'm going to combine those two. And in a few weeks, I'm going to be going to Disneyland, the one in Anaheim. But another person, well, actually a couple who wish to remain anonymous, have given me $1,000 worth of Disney bucks that don't expire. And I think I'm going to use these for Disney World because I hear it's better. I've never been there, but we're going to have to wait until Bailey crosses the Rainbow Bridge. She is on hospice and palliative care right now. Not that I want her to go anytime soon, but I even said to Charles that when she passes, even though she's the dog love of our life, that of course we're going to be sad. Let's just get on the next plane to Florida. So if anybody wants to join me at Disneyland, I'll let you know. So, there are people live. I haven't even checked. So sorry about that. That was a long introduction. Without further ado, the man of the hour who is here as my friend. He is a medical doctor, but he is not my medical doctor, but he's here as my friend to help me through this difficult time. And just like the Academy Awards for Best Picture, you're going to have to wait a little bit until we reveal these results. Please welcome back Dr. Matt. Hi, Dr. Matt. How are you?
I am doing well. How are you doing, AJ?
How am I? I got cancer. How do you think I am? That never gets old. I do that to people. I don't do it to people that don't know, but I mean, that's Bailey's barking. Right now I'm good. And I'm looking at myself and I don't look too bad for somebody with stage 3 cancer, quite honestly, you know.
Yeah. You look good. Your attitude and energy are always inspiring, and just happy to be here with you, AJ.
Well, thank you for doing this. I mean, it was so great that you just kind of, I don't want to say fill Dr. McDougall's shoes. Those are big shoes to fill, but kind of doing for me what he was doing, for the first couple of years. And so I'm very grateful for that. And also you do it with humor, which I love because, it doesn't, of course there are sad days. And I'm so glad we didn't go live yesterday because the day that I got the biopsy would be a whole different show and I'd be a whole different look, because yesterday was a day that I pretty much did cry all day. But, I don't let every single day define me. Just because yesterday was a bad day doesn't mean today is going to be a bad day.
Yeah, and I love what you've really grown in your ability to take your feelings and let them pass through versus try to block them, prevent them, keep hold on to only feeling happy. It seems like you've just become more accepting and allowing whatever feelings are coming up to pass through.
Yeah, and that ain't easy. And there are people in the more holistic cancer space that believe that that's what causes it in the first place. So you got to, that old saying, the only way out is through. But boy, it's it's not easy to let. I'm not saying it's easy at all.
It's not easy, but I do find it gets easier as you do it more and more. Is that what you're finding too?
Absolutely. It gets less scary, you know?
Yeah. Yes,
Because
and you start to remember the how good it feels when you do process the feelings in that way. So you know there's a relief, there's an inner peace that you achieve, even if it's unpleasant as far as the actual emotion.
Absolutely. And that's, it's through the work with Mark the Magic Unicorn that's helped me do that because even though it's sometimes difficult when we do that, I keep coming back. So there has to be value there. But also, having cancer sets the bar so high that other things are so less important. Like when you get little slights or somebody hurts your feelings, or cuts you off, it's like one of the reasons I've been able to do this is, well, one, I don't look at social media anymore. And I know people have told me there's been videos made of people for likes and clicks speculating. They're not doctors why I have cancer, but I figure, what could anyone do to me that's worse than having stage 3 cancer? Really? What? So it's like the things are, it's so different now, the way I respond to things because, I got the bar is set pretty high now with what bothers
Yeah,
me.
and people have different reactions to the same experiences. And you like to use humor. You find that healing and medicinal in its own way. And I think you even mentioned that you might even make jokes about your cancer. And to some people, that can be off-putting. To other people, that can really be comforting. And for everybody to figure out what works for them and to follow that path.
Absolutely. And that's the main thing. People have to know themselves. It's a whole thing when I used to teach weight loss, it was just know yourself. What works for one may not work for another. And it's the same thing with cancer treatment because there's not like one cancer treatment, and there's boy, I mean, I'm becoming not an expert on cancer, but an expert on maybe having cancer and just talking to people. And it's just, I mean, it's when people are diagnosed, I mean, I'm not saying there's other things in life that can't be worse for people, of course, losing loved ones, and other people have different tragedies. But there's something about that diagnosis that just it just devastates people. And now that I'm in groups, and I'm still one of the newbies after a couple months, but when the new people come in, it's like I see myself in them. Like it's I don't know how people do this for a living. It's very hard because it not only affects the person, but it affects the family. And I think part of it is the uncertainty. With other diseases, not that it's great to have other diseases, but there is a protocol that often works if people follow them, but not so much with cancer. There's really no guarantees. And that's where living life to the fullest right now comes into play because none of us have any guarantees. But when this is facing you, it's like, the time is now to live now. And I guess
Yes.
that if there is a gift of cancer, which I don't know, it's a present that I did not want. I guess that's it. And but it doesn't mean it's easy. It's like I mean I don't go live on the days that I don't get out of bed. I mean,
Yeah,
that would be an
and
interesting video.
just of you in bed.
No, it just, well, like yesterday, I was so defeated and devastated by these that and it's funny because I had a session with Dr. Lyle and it's like, I don't think I can even talk to you. And I did it from my bed. And it was very helpful though to talk to him. But I tend to be an anxious person, but what's interesting is my anxiety now is completely acceptable for what I'm going through. So when I think about my whole life being anxious about things that really didn't matter, the sky is falling. It is kind of falling now. And so even people that like would have wanted to medicate me on psych drugs in the past are saying, no, your anxiety for what you're going through is actually appropriate. And I don't mind anxiety so much because I've learned to live with her. But when I do get depressed, which isn't often, that's hard. And that was yesterday. But hey, it's a new day.
And it just, what did you do? How did you embrace the depression, even though it was so unpleasant?
Well, what it does is it made me sleepy. And so I did go to bed and I took a couple of baths and I mean, that's a terrible feeling because when I think the worst feeling in the world is hopelessness. And that's what happens sometimes with cancer. And that's why starting January 1st, I don't want to be doing live shows every day because I still have a job and all my treatments, but I want people to know that there is a hope in the face of cancer. So I'm doing a series called, well, you'll probably be on it, I think, Thriving in the Face of Cancer, where I've got some real heavy hitters coming on, like Dr. William Lee, who's a cancer researcher, Dr. Joel Furman, and Dr. Jean Ornish. But we're also going to focus on people that I've been finding that are survivors, because to me, that is the most helpful thing. Whatever you're going through in life, and maybe it's not cancer, if you can find somebody that had what you had or did what did and came through the other side, to me that's the most encouraging thing, and I find that that's the most helpful thing. And if you are somebody that has survived cancer, but specifically lung cancer, please email help@chefaj.com, and I'd love to get you on the show. And now that I've met a 10-year, a 12-year, and a 17-year survivor, those kind of things give me hope.
Yeah. And that's what's really important, is to never lose hope. And how do we balance getting information with maintaining that hope? And then also, one of the things that I do when I work with people, I think is so important, is I might have information, but it's equally, to me, even more important to know what you're interested in, what works for you, what doesn't work for you. For example, I believe you said, I don't want people to give me these statistics if it's not going to increase hope. Or I don't want someone to tell me what a prognosis is, because that's generalizing lots of people, and everybody's different. So I think really being careful about what does that person want, how does it work for them, and to realize that cancer, even though we talk about it as, oh, you have stage 1 or stage 2 or stage 3, that implies it's the same. Everybody with stage 3 has the same biology, the same disease, and every cancer is different. Every cancer grows differently, it doubles at a different rate, and how it responds, and the environment, the soil with which your cancer is living, can be very different. And that's what we can modify. And when you modify all of that, you change the trajectory of your disease.
Yeah. I think what precipitated it wasn't so much the results. It's just anytime I go to an oncologist, my mood just lowers. And when it came to the point of, wanting the statistics about how long you're going to live with or without treatment, I said, I don't want to know. And I left the room. I said, you can tell him, meaning Charles, my husband, I don't want to know, because I don't want that to define me. Because, what if she said 3 months? And so does that mean I mark my calendar and then, I don't want to know. And I said, if you have bad news, I don't want to know. Well, I mean, obviously I wanted to know these results, because if I'm going to get treatment, but it's just, they're just so doom and gloom. I'm not expecting my oncologist to put on a red nose and be like Patch Adams. I'm not saying that, but man, it's just, I just have to stop going to that. It's, but if you get treatment, they're the ones that do it, unfortunately, but so it's nice when you see somebody that is not doom and gloom,
Yeah.
that's that,
And
I,
trying to find that special oncologist is really hard. In fact, that was one of the I wrote down one of the pleas for people watching, is that if there's an oncologist out there that is really brave enough to think outside the box and to work outside the box, to really hone and target what the client or patient wants, that would be wonderful to be connected with, because so many of them are focused on specific guidelines, and this is the protocol, and they don't want to, because of insurance reimbursements and pressure from their academic institution or their group. It's very hard for them to really focus on what the patient wants if they want something different. So, for example, we talked about immunotherapy, and if someone says, well, you have to get surgery and you have to get chemo and you have to get radiation for you to be considered this, that really takes away your ability to do treatments, for example, not taking into account your challenge with surgery, which is actually not even about the surgery. So we really are looking for an oncologist that is brave enough to tailor treatment that best meets your needs.
Yeah. It's not cookie cutter. So if you are an oncologist watching, or if you know somebody that's like that, please email us at help@chefaj.com,
Yes,
um,
please do.
because that's what, that's been one of the positive things about going live. And people are putting some drug ideas in the chat and stuff. And we'll talk about some of those too, because we did actually see one of these out of the box oncologists. You went with me with my virtual appointment, where that's one of the things we're considering.
Yeah, it's if we can get that support, it's one of the more challenging specialties to work with, in my experience, has been oncology, because they are very focused on the regimen that they've been told or believe is the only way to treat that, and taking into the patient's situation and their needs is not as easy for them to do. So hopefully we can find somebody that will work with us on that.
Great. That would be great. And if you're near Disneyland, so much the better. No, just
Or
I'm
Disney World. We'll go to Disney
I'm
World.
I'm kidding, of course. Yeah. So yeah, and also I wish there were more mental health experts for oncology. I know that Stanford has a psycho-oncology department, but if you're not a patient there, they won't see you. And while of course there's people in the mental health space that are wonderful, it would be nice if there were just, I would love to meet a mental health professional with focus just on the specific anxiety and depression that comes from having cancer, because it's just different than the everyday anxiety. Believe me, it's much more heightened, and
Which very clearly affects the in the cancer and the environment of the cancer. Actually, if there's time, I'd love to talk a little bit about that so that people can understand the impact of social and connection and how you're thinking and how you're interacting with your environment that affects your physical health as well. I think that's really important and it often gets overlooked. And as much as we believe that food is at the foundation of healthy living and optimizing your health, it's not just the food.
that's right. We need to get a new t-shirt that says it's not just the food, because the food is very, very important, but it isn't just the food. And, at least it hasn't been for me. And so, like I say, if I knew I was going to get cancer, I wouldn't have eaten so much kale, because I can't just throw kale at this, and I know there's still some people out there that believe if only my diet was more pristine, if only I would go 100% raw now, or I don't know what they're thinking, but and it's not that I didn't try these things over the past 2 years, including 2 water fasts, which are just miserable, you know miserable for me, so yeah. Anyway, should we I don't even know what these means. And by the way, these results aren't completely in, because some of the things they do, I think it's called the staining or the genetic testing, those take a few more weeks to come in. So anyway, the award for best lung biopsy. No, and by the way, and I got, this is why I'm so afraid to get treatment, is because, they said, oh, a pneumothorax only happens 20% of the time. Well, I was one of the 20%, and it wasn't a bad one, but they don't come without pain, pneumothoraxes, even slight ones, they do hurt. And so for
Yes.
5 days, I was in, considerable pain and couldn't exercise. And so, that's another reason that I'm kind of like not interested in rushing into treatment. But here we go, the surgical pathology. So, do you have any idea what this means? It's a I have no, it's 3 pages. So you want to say what this means? Oh,
Yeah.
oh, sorry. I
What
just
is
want
it?
to say one thing. So Dr. Roger Schwoldt, who's going to be on the show in January, he's a fabulous quadruple board certified plant-based doctor who was my lung doctor when I lived in the desert. One of the things he said is no meat, no treat. And what that means is that without a biopsy, they really don't know that you have cancer. And I think one of the reasons I was so devastated yesterday is because I do. I mean, it is inconclusive. It's conclusive now. So even though the PET scan showed it, the CT scan showed it, the liquid biopsy showed it, without that tissue, they can't really say it. And so it was kind of like being diagnosed again for the fourth time. And so
Mm.
I really had to accept yesterday, okay, I have cancer.
Yeah.
Lung.
So that it really hit home for you yesterday, or was sort of pushed in. You had, it's hard to believe anything else after you see that, right?
Right. I was hoping that just there was some miracle that I knew kind of once they found the Met on October 18th that it wasn't likely that it was something other than cancer, but I was just like thinking, well, but it just, I just, because yes, so that was like it was devastating, because even though I knew, I kind of didn't want to believe it, but now I believe it. So now I got to do something about it, or nothing. Doing nothing is also doing something.
Yeah. Yeah. And it did show the adenocarcinoma of the lung, and you're right, they do need to do the molecular testing and other things, mutations to help us determine what's the next best step, what, things like what treatments will be most effective, and that's going to take a couple more weeks.
Yeah. So, what I asked for was if I could be submitted for clinical trials at an academic university. And the oncologist said that would be fine. And she said, where do you want to go? And so from my limited research, I chose Stanford because I already have an oncologist there and it was close and I have family there. And I chose MD Anderson. So we'll see if I can get accepted into one of those.
Yes, yes. And that's fingers crossed that there's some treatments that can really hit the numbers hard and not just talk in a matter of months or years difference, but really, really curative.
Yeah. The thing that's harder to hear now, at least from the recommendation from my medical oncologist, is that if I do decide to get, I call it the standard of scare, the standard of care, now they want to do all of them. So when I was first diagnosed on April 15th, 2023, and the tumor was 14 millimeters at stage 1A, the surgeon was willing to operate and just do that. The radiation oncologist was willing to do radiation and just do that. But now that I jumped to stage 3 with a MET, now all of them, I don't want to say they're in cahoots. It's not like they're conspiring against me. And I know that their desire is to help me, but they're not treating me holistically, and they're not understanding that how a person with anxiety can't just like jump into an operation, especially with a history of allergies to anesthesia. Oh, I do have a smart doctor though that yesterday ordered an anesthesia consult for me. So that, and nobody has done that. Like, duh, that would have been great to maybe talk to somebody that administers the anesthesia. But the thing is now they don't want to do just one thing if I go the traditional route. So in other words, I've already asked for immunology because that's what Dr. Goldhammer thought would be a good idea, but they won't do it without chemo. They just, at least at this institution. So now if I elect for surgery, which is still an option because they say they can remove the tumor, which is they'd have to do the whole left lower lobe. They can't get a clean margin or do a wedge resection. And I believe they can also remove the lymph node metastases. They want to do chemo first to shrink it. And if I elect for no surgery and radiation, they want to do chemo first to shrink it. So now I can't just get one of those three. It's like you got to get either all three or two, which is a lot. And I'm a sensitive person both emotionally and medically, and it's like just getting to the point of the biopsy took me 2 years, and it's just I don't want to, I don't know how much time I have left, and I don't want to feel sick during it. You know what I mean? I want to go to Disneyland. And so I think they think I'm being foolish that I care more about the quality of my life than the length of my life. And I also have to take Charles's feelings into consideration. That I think the impact of cancer on the family and the spouse is very real, and that's something I'm hoping to address on the show with an expert because it affects everyone. It's not it's a multi family disease, if you will.
Yeah, and it's hard to balance all those feelings, all those different opinions. I'm sure you have friends and family that all have their ideas of what you should do, and it's hard enough to care about and know what's going on inside your own heart. And then you have, to think about Charles and think about everybody else. It's a lot to hold, right?
Yeah. Well, it's hard to know because like there's no guarantees. I don't have a crystal ball. And so I don't know if doing all these things is even going to extend my life or even improve the quality of my life. Man, it's so hard when you have no symptoms. Like, so the idea of making myself sick with chemotherapy or possibly radiation or having to go through, and again, lung surgery it's not like getting a tooth pulled. And getting a tooth pulled, I think is actually a big deal for, at least for me. I know now four people, and vegans actually, three of them that had lung cancer and one that had something else that have had their whole lung removed. And while they're doing fine now, it's not like a real easy surgery. It's a painful surgery. They've been in pain. They were in pain for a long time. Some of them still can't sleep a certain way. And while they say it's the gold standard, if I understand cancer correctly, taking out the tumor doesn't get rid of the cancer because it was found in my blood. Is
Yeah,
that
that's exactly it. The treatment does the way cancer works is it starts as one cell and then doubles to two and four and eight, and it keeps growing, and it's spreading well before we can see it. Cancer is usually zero point 0.2 centimeters, 2 millimeters to a centimeter big by the time you can see it on our scans. And to be a millimeter big, it's a million cells. That's a lot of doublings that's been happening before you can before you can see it. And that's a millimeter. And in most cancers have to be a centimeter, which is a billion cells or somewhere between that. And cancer is usually, if it's the kind that's going to spread, it's spreading well before. It's spreading at year 4, not at year 10 when you can see it. So I think if people realize that the stuff that's going to cause the most damage is not the primary tumor, but the spread of the tumor everywhere else, then you start to see why attacking the primary tumor and why McDougall was so against attacking the tumor with surgery and radiation was if you had the kind that was spreading, the horse is already out of the barn. So how do we reconcile that? How do we still increase your lifespan and quality of life without doing harm? And a lot of the conventional oncologists talk about, hey, we can still cure you, we can still make all your disease go away. And sometimes the way that the language they use is different than the way we understand that language. So I don't know if that's confusing or not, but how do we treat the cells that are already out there? And the idea is that chemotherapy is what's going to do that. Because you agree, AJ, that surgery and radiation are attacking the primary location, but they're not any cells that sort of spread into the blood or the lymph. The surgery and radiation isn't attacking those. Does that make sense?
Right, it makes sense. And if the tumor was big enough or it was pressing on vital organs and I couldn't breathe, then it would, to me, make sense to want to do something. But when I see the thoracic oncology surgeon or the oncologist, they make it sound like if I keep waiting, it's going to be too late. And that's what scares me. And, and part of me wants to just do what they say to get them off my back. And so that my brother, who's a doctor, will stop yelling at me, why didn't I get treatment? And so it's not an easy decision.
Right.
Mhm.
And I want people to be very clear that when I work with people, what I'm telling you is that you got to do what works for you. I know what would work for me, but that's very different, and I'm not in your shoes. So whether you get surgery, radiation, chemo, my goal is for you to understand what it can do, what the numbers show, and what they don't show, and then you make a decision. And we talked about that, the impact of chemotherapy, for example. There's a really good article that looks at the impact of chemotherapy alone on 5-year survival. And for lung cancer, it was about 2%. That's pretty low, but it's something. And then do they talk about the risks of chemotherapy and radiation and the side effects? And then you look at all of that and you start to say, okay, well, is that worth it to me or not? And then we support that decision. So AJ, when you hear numbers like that, different cancers are different. Testicular cancer and chemotherapy, the benefit is close to 40%. Hodgkin's lymphoma. So I'm not saying all cancers are the same, but for a lung cancer, chemotherapy might have a small impact, and then you have to decide if it's worth it.
Yeah.
And
Luckily,
then also, do they tell you about when you take out your lobe and the reduced respiratory capacity, so your ability to breathe or increased vulnerability to illness and radiation causing fibrosis or potentially damage to the heart that can happen even if they are as careful as possible, chemotherapy and nerve damage or impact on the kidneys and bone marrow, long-term fatigue. So all of these things are not to scare people. It's to give them and all the information so they can say, okay, great, I did what I was supposed to, and I knew that this was a possibility versus being shocked that they have all these problems afterwards. And then also to be clear that when we're talking about, we don't care about things like progression-free survival or tumor shrinkage. What we care about is impact on median overall survival. And when you take all these treatments and put them in, depending on the cancer, we're lumping. Remember, I said everybody's different. We're lumping everybody into a single group, but those give you a couple more years, and then you do some type of immune therapy. It gives you a couple more years. When you're comparing that to surgery alone, they won't even compare not doing any of these treatments because they say that's unethical. But to me, how do you know how something works if you've never ever compared it to not doing that treatment? And I still to this day don't understand why they don't have studies that look at people and they say, okay, we're going to put all this chemotherapy into your body. We're going to compare that to not doing something. And I don't understand why they're so against doing studies like that. But that would be really helpful to have that information, right? You've asked doctors about that, and they'll say, oh, we don't have that data because it's unethical to do those studies. Has that been your experience?
Yeah, and also I think that most people with cancer don't want to do nothing. And I've so far only met one person that had stage 4 that did nothing and her tumor went away, whether you want to call it a radical remission or spontaneous recovery. Unfortunately, she does not want to come and tell her story.
And there's all sorts of cases out there. And the goal is for you to be that part of the group that's had, I don't care about 5 year survival. I want 20 year survival. To me, that's curative. Is what are the odds that 20 year survival? And if the treatments are going to affect that, great. And then regardless of what you do, chemo, radiation, surgery or not, let's also bring in the other pieces that are also health promoting. And I think that often gets missed too. Never would I say do nothing, but all this other stuff that you're doing, regardless of whether you do surgery, chemo, radiation, is something.
Yeah. I don't want, I want to address all that, but is there anything more on these 3 pages that you can share with the audience that's more medical that I wouldn't understand? And if, I mean, I can put these in the show notes, but is there anything here that sticks out in terms of size or type, or is it just basically confirmed stage 3 lung adenocarcinoma?
Basically, it confirmed the lung adenocarcinoma because you have that in your in lymph node. The biopsy doesn't confirm the stage, but based on the PET scans with it was 2 centimeters in the primary of the left lower lobe, and then you had and again this was in the PET scan
Mhm.
on the most recent one. You had a smaller 8 millimeter lymph node in the on the left sort of
I
right
didn't
where the
even
lung
know that.
attaches.
Wait, so see, this is why ignorance is bliss. So are you saying I have an 8 millimeter metastases in my lymph node now?
No, there was based on that's there was the primary nodule,
Which is
and
now,
then what you right. Remember you said that the doctor at Stanford called you stage 3 and told you that because it's now there was much smaller mass that was in the lymph node that they were trying to determine if they were going to biopsy.
they want to biopsy that, but why? I mean, why would
They
would
don't.
treat, why would treatment even be any different? And the thing is, to biopsy the lymph node requires general anesthesia, unless I can find a pulmonologist that will do it under light sedation, and that's why I refuse. But I don't think how it could be a different brain MRI negative for cancer in the brain and bones. Yay to that. So I don't think we even talked about should I get an EBUS to biopsy these lymph nodes.
Once
What
you got the biopsy of the primary, you don't need to. But they were determining if they where I guess based on what you said when you talked to the doctors, they were determining where to go and what would be the easiest approach given your situation. But because of that, that's why the doctor at Stanford gave you the stage 3.
Yeah. Well, even just to get this lung biopsy, you have to sign away your, basically like that you could die. Now, I mean, it was unlikely to die from a lung biopsy, and the doctor I had said he has never killed anybody in a lung biopsy. But you still have to sign this piece of paper, and when you read all the possible things, it's like, why does anybody do anything? And for surgery, and even, oh my God, radiation. I had my tumor is less than 2 millimeters from the aorta, so I went and to a cardiologist to ask her about that, and she's like, oh, your EKG is fine. What are you here? Why are you here? And I said, because I'm considering radiation. And like you said, there are people that have had like she's going to be on the show, Dr. Dawn Musalem, who because of radiation had to get a heart transplant.
And that's important to consider. It doesn't mean you shouldn't get radiation. It means to have that information. A lot of people go in and they think this is going to only fix me and there's going to be no harm or no risk or no side effects or very little, and they jump in and then they're really shocked.
Yeah. So anyway, so what am I going to do? Well, just so you know, I have asked to be in clinical trials at an academic university, and whatever I say, somebody's going to judge me, and whatever I do, somebody's going to say that was stupid, that was wrong. So you're not, if you were in my shoes, you would do what I'm doing because you would be me. So you know,
Exactly.
but I am.
It'd be really wonderful if people would instead of telling you what to do, just be more curious and supportive about what you are doing, and then ask if they want if somebody wants your opinion or their opinion, if ask you if you want their opinion about what they would do. Wait until you tell them you would love their opinion before they give it to you. That would be really, I think that would really be enjoyable.
Yeah. It would be nice if I could get support like I'm getting from you and some of the other doctors at my local hospital, Sutter, where I go, because one of the things that we're considering is the use of off-label drugs. And do you want me to try to get Dr. Makis on the show? I feel like a lot of people will you know, I mean, he's controversial, you know?
Yes, very controversial. And I like getting the information and then people making a decision. If vaccine is another one that gets people really upset one way or another. And my feeling is get the information and then do what works for you. But let's let people talk. Let's let people share their information, and then you make a decision. So I mean, if I came on and started telling you how unhealthy fruit is, and you got to stop eating fruit, and it's terrible for cancer, and you would say, great, thank you for your information, but that doesn't work for me. That doesn't jive with what I know. So I really hope that we can get all of these different opinions, and then people can make their own decisions.
Oh, you know that old saying, opinions are like assholes. Everybody has one. Everybody's stinks.
Exactly.
So,
I like
oh,
that saying.
that's sorry about saying a bad word, but yeah, it's like that. There's another saying, if I wanted your opinion, I would give it to you.
Exactly. Exactly.
So Dr. Makis, who I had a consultation with, and you were there to help me ask him questions, has I don't go on social media, so I have a friend that's sending me the articles where, and then I'm particularly interested in the people that have his help with stage 4, and particularly lung cancer, has a protocol of using off-label drugs to help shrink tumors, and they are ivermectin and fenbendazole. And I did not want to just take them without a doctor here in California actually monitoring me and prescribing them for me. And I'm not going to say the doctor's name because maybe he doesn't want to know. It's not you, just so, I mean, you would know if it was you. It's not. But he did a lot of research and he was willing to prescribe them. But he wanted me not to take fenbendazole, but menbendazole. And his reason was, and I actually talked to the pharmacist today. I did order it, and it's not even that expensive. It was like $86 for like a 3 month supply, and the ivermectin wasn't expensive. And the pharmacist was saying that the reason the doctor probably did that is because the menbendazole has been used for humans. At least they have some more research, whereas fenbendazole hasn't. So that's something I'm considering doing after the first of the year. And the reason I'm waiting is I'm going to be traveling tomorrow and I don't want to start medications that could possibly give me side effects if I'm not home. So I was thinking of doing that January 2nd. I've got nothing to lose because I mean, I can't imagine that those drugs being as toxic as like chemotherapy, you know?
Yeah, and I want it's so important that you have support, AJ, to do what works for you and help you metabolize the information. It's one of the reasons when I work with clients like I'm working with you, we call it a crisis concierge. And I specifically don't treat or get involved in that. It's to really help you metabolize information, learn how to ask the questions, gather that information, and then with empathy and care, support you in finding what really resonates with you. So to me, it's very important to have that support system when there's so much information coming at you. There's so many different directions you can go. And whether it's understanding a medical study or how to communicate something to a family member, getting that support is so important. And then we find the doctors that can do the prescribing so that it's very clear that the advocacy is separate from, and I don't have a vested interest in you doing one treatment or not, but it's really helping you get to what works best for you.
Well, one of the things that you take into account and is the whole person and the psychology. And there's a part of me that wants to just do everything, including, the standard of scare, surgery, chemo, and radiation, because I feel that in some ways that could actually reduce my anxiety if I was able to do the treatments. So in other words, because I have anxiety, I would love to do what Dr. McDougall said and never go to the doctor again, right? I mean, that would be the
Mhm.
ideal. But because I've had a lifelong history of anxiety and OCD, I'm a checker anyway. Did I turn the flat iron off? That kind of thing. And so now that like you say, that the toothpaste is out of the tube, so to speak, because I wish I had not known. I was not looking for early detection. I was the person that did not get the colonoscopy when told, or the mammogram. I was not looking or hoping for early detection. It was found accidentally, incidentally. But because I know, I feel like unless you could get me that magic pen from Men in Black, where, I can't unknow. And because of my psychology, I can't even when it was, I can't even go a year without a CAT scan and checking, even though at one point when it was so slow growing, they said you could wait a year. 3 months sounded excessive. So I was doing, 6 months. So I wish I could just forget about it and live my life. I think there are people that could do that, but because I know, and because I got this thing inside me that's growing now with my anxiety, it's like, every little thing, like I happen to have a toothache now, and I'm sure it's just a toothache, but it's like, like a cancer, so I
Yes.
feel like doing something could really help my psychology of
Yes.
anxiety. But the thing is what to do, right?
Yes, and that is so important. So regardless of the number of years that a treatment adds based on a scientific study, does it make you, getting that sense of acceptance from your community and that trust that you're doing everything right and that your family is all supportive? All of that is important to, not only to your emotional well-being, but actually your physical health. And I'd love to talk, maybe this is the time to just do a few minutes on that, AJ, if about the impact of social and our interaction with our environment and how we think and the impact on our health. Is that okay if I take a couple of minutes there?
Yes, please take all the time you need.
So, for people that say that your mental state and your anxiety and your connections and your relationships don't affect your health outcomes, I really want them to go look at things like the Steve Cole's work at UCLA, the conserved transcriptional response to adversity. And there's a Robert Navio in UCSD. He talks about the cell danger response. And I'm going to talk about those real quickly here. The conserved transcriptional response to adversity is a pattern of changes in gene activity that occurs when we experience chronic stress or any type of perceived threat. And a perceived threat can be, I mean, a lot of what you're dealing with day to day, AJ, is essentially threats to your safety and how you're worried about your cancer and how that's going to impact you. So, what happens when that gets activated? These gene expression shifts. So, the increase in inflammation is one of those. The body ramps up its inflammatory response, which is helpful in short term situations, but can be harmful if it persists chronically. And it also decreases antiviral defenses. So the body's ability to fight viruses diminishes, making us more susceptible to infections. And this is all the CTRA. You can read about this. There's podcasts on this. It's scientific articles. As far as the relation to cancer, chronic inflammation can create an environment that supports cancer growth and allows cancer cells to spread more easily. So triggers of this CTRA response include social isolation and loneliness, low socioeconomic status, chronic stress and psychological trauma, and even a lack of sense of purpose or meaning in life, what they call eudaimonic well-being versus hedonic well-being, which is focusing on pleasure and avoiding pain. Eudaimonic well-being is this purpose and meaning in life. So what was interesting is that all of those increase inflammation, decrease our ability to fight viruses, and create an environment that makes it more supportive of cancer versus fighting cancer, and more supportive of the spread of cancer versus slowing down the spread. That was the CTRA response, which you can look. That's about gene expression. There's also something called the cell danger response, which is a protective reaction that cells initiate when they detect danger from sources like infections, toxins, or injuries. But also, what they found was that social threat can also trigger the cell danger response. And when these cells shift because of these threats, they shift their regular function to sort of this defensive state, aiming to protect the body and start the healing process. But if this cell danger response remains active for too long, it can um, cause all sorts of problems. It can alter the environment around the cells, making it more conducive for cancer to grow and spread. It can suppress the immune system's ability to detect and destroy cancer cells. It can provide cancer cells with resources they need to thrive. And again, the triggers of the cell danger response include infections, exposure to toxins, physical injury, radiation exposure, and chronic psychological stress. So that while the CTRA and CDR, the responses, are natural defense mechanisms designed to protect us, prolonged activation can inadvertently support cancer development and spread. And the importance of managing chronic stress and maintaining a healthy lifestyle to help regulate these responses to not only improve overall health, but reduce cancer risk and growth and spread cannot be understated. It is so important.
Well,
So I'm going
you
to stop there. How does that sound to you? Is that
well,
clear, or is that?
well, here's the thing, people believe what they believe in general. And so I believe that, and I at a very young age, well, not very young, 27, I got into a book called You Can Heal Your Life by Louise Hay, and not everybody believes that. And especially medical doctors don't necessarily believe that. I think the faith-based doctors tend to believe that more, but there are people, and some of them are our dear friends, and I'm not going to mention their name because somebody actually asked on this person's podcast about what you said, and they, as you know, I don't want to, I don't, you know what I'm
Yeah,
saying, right? This doctor said, "Oh no, there's no evidence that stress," they basically denounced everything we said. So people are going to believe what they're going to believe. It does resonate with me. And, it's funny because, I was always had a little bit of Dr. McDougall in me. And in my 40s, when the doctors were saying, "Oh, you have to get a colonoscopy, you have to get a mammogram," I'm like, "No, no, I don't." And I would be real like adamant about it. And I did get chest x-rays, by the way, because I did get physicals once a year and they do chest x-rays, but they could never see the tumor because it's behind the heart, so it wouldn't have showed up anyway. And I remember a doctor saying to me, "Well, what do you do? What are you going to do if you have cancer?" And I said, "Well, I'm going to do nothing." He goes, "What do you mean do nothing?" I said, "Well, I'd probably go to the True North Health Center and fast." And that's exactly what I did. I mean, I never thought that, this would be, prophetic and one day I would have to do that. But that's what I always thought I would do. But then when you actually get cancer, then you're thinking like, well, maybe that's not enough. But I do believe, and I'm actually going to be talking to Chris Wark today, after this personally, because he was the first person that I talked to, because Chris beat cancer. He had, colon cancer, and he's now helping people with their cancer. And I've been in his group, and I'm going to ask for some advice from him if he's willing to give it. But he had said to me, he goes, "Well, there's not really much you can do in terms of diet, the other pillars of lifestyle." And, I know you have 9 of them, and he said, "Well, need to forgive everyone." And so I always felt like that if I did get cancer, it would be from another one of those reasons. And of course, there's toxins in our environment and things like that. But I always thought that it would be from some other reason, like some emotional reason, or trauma, or thoughts, or traumas, toxins, or thoughts. And so if I believe that, and I do, and if I believe that I created it, then maybe I can change it by changing those things. And so I'm really getting into things that I was into much more when I was younger, more spiritual things like Louise Hay, Joe Dispenza, because, here's the thing. It's comforting. Even if it doesn't work, it's comforting. Chemotherapy, radiation, surgery, lung biopsies, these are not comforting things. And it's really funny because I have always, and people just, there's a lot of people that apparently don't believe in God. And I was at lunch on Christmas, And the conversation was, I was telling people how I go to church and synagogue a lot now. And it's not that I all of a sudden now believe in God. I always believed in God, but I didn't make time for a spiritual practice or going to a place of worship just because I was working 7 days a week. And I find that I have a lot of comfort now when I'm in that space. And so like there's this church by me, and I don't even care if it's they're labels, Catholic. I don't care what it says. But for me, the thing that has comforted me the most has been being in a place where people believe in something greater than themselves and when they have very nice music. And that's what I found in every church I go to, whether it's Catholic, Episcopalian, Unity. And so there's one near me that I just love called Bridgeway. And they have, and so sometimes I'll do the 8 o'clock service, the 9:15 and the 11, because they have great music. And it's a very, very, like there's young people there and babies and there's a Starbucks. It doesn't feel like going to church. It just feels like kind of going to a rock concert with a message. And so when I went to Christmas lunch, we had a meetup with 40 people. There was some people at the to my right that apparently were traumatized by religion and they don't whatever believe in God or whatever now. And I didn't know that that was the conversation. And I remember, so I was saying how much I like going to church, and so somebody said like, why do you go or why do you believe that? And I said because I have lung cancer, and I started crying like at this restaurant with 40 people, but I feel like people just need to accept people. I think people have different beliefs, and what works for one isn't going to work for another. But I think the idea is just to um, like you say, to be supportive of what somebody has chosen. And for me, that's like the only thing that gives me peace of mind right now. And like I said, I mean, I hope you're watching, David. um, I'm kind of a baby when it comes to medical stuff. And, the chaplain was with me like the whole time in the recovery room. Like, who does that? Like, do you understand like how meaningful something like that is to a person? A total stranger holding your hand after a procedure that doesn't leave you. I mean, to me, like that's what's going to get me through.
Exactly. That is the power, delivering the care, not the intervention. And we've shifted the environment to where doctor's job is to deliver the intervention instead of the care. And that is so important, AJ, regardless of what you do, regardless of what treatments you choose. You need people on your side supporting you and advocating for you and encouraging you and loving you. And whether you live 5 years, 30 years, or 5 more minutes, it's that people care about what works for you instead of telling you what works for them.
Yeah. So anyway, and having
What a
fun.
beautiful, what a beautiful thing though to have support like that. When you have it and you feel it, isn't that just so amazing?
It's the best. And that's kind of what like always having a dog did for me too. Unfortunately she can't be in the operating room, but that's I think that's what's missing from medicine. And I wish that any of the doctors at my local institution would, so if I do decide to go ivermectin and bendazole, and that's what it's looking like, they all not only don't support you, but they're like, well, that's not a good idea. And, there's no evidence to support it. And, I'm thinking, is the reason there's no evidence to support it because like there's no money in these very cheap off-label drugs. And so therefore,
Exactly, exactly. Who's going to study these cheap off-label drugs to get the studies to bring the evidence? The only thing that gets studied is something that's going to make lots of money. So if you're never going to try something that doesn't have the evidence you want, you better hope you can charge lots and lots of money for it, or you're not going to ever see that evidence.
yeah, but I think I mean, I wish I could find this piece of paper. But I'm going to look for a piece of paper and to show you. So I am doing something. It's just I'm not necessarily doing standard of care. But while I look for this piece of paper, maybe you can talk about these, which I got, and I got one for Charles. I got him the blue and myself the green, and maybe you can talk about what these are.
Yes, so the Weeby Calm device we sent you is something else that we created to help people with anxiety and other challenges around stress to learn how to turn on the parasympathetic nervous system. If you could pull one out of the box, AJ, that'd be great. But this is a breathing device that it helps you slow the exhalation, focus your attention on a ball that raises when you slow the exhalation to hold that ball aloft. And there's some white noise that comes out the side as well. All of those are turning on calming pathways that stimulate the parasympathetic nervous system and train your body to turn on calm at a moment's notice when you start breathing that way. So we'll have people use those every day for maintenance, to use those at night before bed. You do 5 to 10 breaths. We have our kids use them. They're designed to be kid friendly, and you can use these. And then anytime you feel stressed, if you just remind yourself, they're called the Weebee Calm, WEBEKALM.com is where you go to get them. And it's take a Weebee breath. So I'll work with my kids or myself, and I'll just say, oh, I need to take a Weebee breath. And I immediately, my body has that muscle memory of how to relax and soften in to that calming state, triggering the autonomic nervous system to do that. So AJ is going to show you here, but you
Okay,
can put it together.
it looks like it's just two pieces and it
It's
has a
just
little
and with a
bag.
bag, and push the back on all the way so you can make sure that's on fully.
Okay, and
You
it
can
comes with,
put on the other side, AJ.
oh,
That's the mouth. There you go. Yeah, there you
of
go.
course I did it wrong. Okay. Oh, yeah. Yeah.
And now
Okay.
before bed, because not only reminds you to do it, but it trains you that visual and tactile part of the whole process. Even though people can say they know how to breathe, there's something about doing this exercise at night regularly every night before bed, so that when you don't have it, you can turn it on. So take a deep breath in through your nose and then blow out through your mouth, and try that, AJ. So you breathe in through your nose and then blow out through your mouth, through
They
the
won't,
device.
wait, they won't be able to see it unless I'm talking. So take a deep
Okay.
breath in through my nose and blow out through my mouth. Is the ball supposed to go all the way up or am I supposed to
Ball,
keep?
you're supposed to try and keep the ball up for the entire exhale of 10 seconds.
Oh, okay, okay. This is different than my spirometer.
It's
Okay.
the opposite, right?
Okay. Here we go. Okay. Inhale through the nose, exhale through the mouth. That's it.
Perfect. That's it. And you do that, you repeat that 5 to 10 times. You can do it as many times as you need. I have them by my computer, but at least before bed, to use it once a day, do 10 breaths or 2 sets of 5, and get that experience every night, so that whenever you want, you'll see over a period of months, all of a sudden you just say, oh, I need to take a weeby breath, and your body just calms down.
Okay, I'm going to do this. I mean, again, there's no side effects. Did you invent this?
Yeah, Alona, and our partner Ryan. So it's everything that we're doing is to try and support connection and calm and that type of health.
Well, I can't. My only advice is you need to make a purple one because that wasn't the one of the color choices.
That's actually my other daughter said that too.
Yeah.
The bracelets are fun, as they say, we be in this together, and it's all about connection and parents and kids and everybody helping each other to find their calm.
Yeah. And you need to tell people about this. And yes, somebody's asking, can you buy these? I'll get a link to these and in the show notes as soon as possible. And you know, you have a podcast. We got to talk about you. Enough about me. You have a podcast.
Well,
Yeah.
people can find out more about us. They can go to our website, connectiondocs.com, or they can go to buy the device. It's weebecalm.com. And our podcast is about helping parents bring more connection and that sense of safety with the children, but still meeting the needs of the parents. It's called We Be Parents. You can go to webeparents.com. So there's all sorts of stuff that we're doing. We actually, AJ, we created an AI coach that supports people when they're upset or angry or feeling disconnected. And you can talk to them, this coach, and they can help you navigate that conflict with more connection and connect better in your relationships. But you can do that with this AI coach that we've trained to work in the way that I work with people, and some of the stuff that Mark does and Alona. So it's pretty exciting. And you can find that out at connectin.com with a K, KINECTIN.com. So thanks, AJ, for supporting this work. It's all trying to help people with the stuff that we're talking about. I appreciate that.
Yeah, and you'll be on this actually. So when we do the series starting January 1st, Thriving in the Face of Cancer, that's right. You'll be on the very last day with Mark. So we'll try to explain what this work is because it's not something that's easily it's because things that are experiential aren't easily explained.
Yes, exactly.
Yeah. So, I mean, if you guys have any questions, I know Suzanne is there in the chat. I'd be happy to answer them. It's hard for me to jump screens to see
How are
what's.
you feeling? How are you feeling right now, AJ? After sharing all that and talking through all that, I'm just wanting to check in. How you doing?
I feel okay, and plus I just took myself a wee bit breath. No. Yeah. Yeah. So, I don't want to inundate people with these, but I know that it's a lot easier for me to do these lives rather than answer hundreds and hundreds of emails, how you doing, what you're doing. So if, it's just easier. I know not everybody, does social media, but I feel like that's the easiest way to disseminate the information to many people. And while I do appreciate the jokes you've been sending me, I took myself off social media the day that I revealed the diagnosis because I didn't want to see anything bad that somebody could write about me, which is, I got this idea from Johnny Depp. He doesn't even apparently watch his own movies. And so when you send me jokes that are like that, I have to look it up on Facebook or Instagram. I can't. So send me like jokes. Did I tell the best joke that I got so far last time? I can't remember about the difference between an oral thermometer and a rectal thermometer. Did I tell that one?
I didn't hear that one.
Yeah. So, well, you're a doctor, so you must know the difference between an oral thermometer and a rectal thermometer, right?
Yes, I did.
Yeah. It's the taste, of course.
Oh
So
boy. Oh boy.
so laughing is good. So, all right.
Well,
Well,
AJ, I want to point, I want to thank you too, because you got me to my biggest pillar of our 9 pillars is around play. That's the one that I need to do the most work on. I'm always working and producing and things like that, but play and laughter. And I said I always want to do improv and you do improv and you pushed me and you said people are scared to death of improv, but they'll do surgery, chemo, and radiation without a problem. And I said, that's for some reason that really hit me. So I signed up for the improv class and we're going to do it. And you're pushing me, even though I'm a little bit, I would say close to terrified. I'm gonna jump in and do that. So you're helping me as well.
that is fantastic. Well, I'm ready to do it with you. It is going to be the most epic class. And we have a very, very kind teacher, Patrick Briscoe, who, historically, that often what happens is improv teachers, acting teachers can yell at you. Are you frozen? I can't tell.
Yeah.
Hello?
I can hear you, but there is a freezing here.
You came back, so it's going to be a great
Okay.
experience. But yeah, I mean, fun is so what if again if I'm going to give people a one lesson for their life. Oh, you've frozen again. I'm curious if I'm frozen too. Let me see. I
Yeah, I
just
checked. I can hear you. I just can't see you, but I checked my speed. I wonder what's going on there.
okay. Well, is okay. Let's see if I can. Yeah, there I am.
Now I
Hello.
can. Now I can see you. There we go.
Yeah, what I want to say is, I mean, don't wait until you get cancer to have fun. If that's something you want to do. And I think I hear from people, I have heard, especially when I was doing weight loss coaching, that people were so unhappy with their job or with their marriage or their relationship, and they're just waiting for the someday maybe. Guys, there is no someday maybe. Don't wait until you get cancer to do what it is you love. You know what I mean?
Exactly.
Yeah.
It's 100%, and it's so hard to do sometimes, and it's so important. I know I struggle with that, and saying, hey, let's live in the now, live in the present. It's not about external factors. Life. This idea that life. I'm going to be happy when I get to there. There is no there there. It's make that happiness now. It's the biggest challenge and most important thing that people can do.
Absolutely. And what I've done for my, oh boy, this is terrible. We were going to impart some amazing wisdom, and now there I'm there. I seem to have to turn it off. So for me, I have these things that I do every day now, and I call them the 7 foundations for thriving in the face of cancer for me. And so I make sure in my life every day I include these 7 pillars. These are my pillars that I made up for myself. They all happen to start with the letter F. And I want to make sure that every day I spend time in faith, with family, in fitness, with food, forgiveness, friends, and fun. So those are like those are my 7 healing factors: faith, family, fitness, food, forgiveness, friends, and fun. And I want it every day. I just make sure that I've spent some time doing those.
I love it. I love it. I love that you make it work for you and you figure out something that feels doable and exciting and inspiring. This is the secret sauce, AJ.
Well, speaking of inspiring, what I think I'd like to do is end just reading a very short poem, which is really one of my favorite poems that was given to me, gosh, when I was in my 20s and I was in a dark time. It was given to me by a respiratory therapy aide when I was a respiratory therapist. I wish I could remember her name because that poem has carried me through. But before I'll end with the poem, but first I want to say, first of all, thank you so much, Matt. It's so fun hanging out with you. It's almost worth having kids.
AJ, I love you. I love your energy. I love your way of your approaching life. I love that you're the ups and the downs and you're riding this wave of life and just inspiring to watch and a pleasure to be with you on this journey.
Well, thank you. And I love you and Alona too, and your support. And I might be seeing you at Disneyland. And I hope to see all of you for the last show of the year on December 31st at 11 a.m. Pacific time with Dr. Doug Lyle. So please send your questions in advance. That way they get answered. Just go to chefaj.com and submit them that way. So I will just end with my very favorite poem that is just, if you are having any trying times or anything that you're going through in your life. And for me, this poem has carried me through many times, and you might have heard of it. And Susanna, I'm sure you know this poem, and it's called Footprints in the Sand. One night in a dream, I walked with the Lord by the beach. There were 2 footprints, mine and the Lord's. But during rough times, I just saw mine, and I wondered why. So I asked the Lord, why leave me alone when I was down? The Lord said, my precious child, I never left you. During those times of trial and suffering, when you saw only one set of footprints, it was then that I carried you. I thank you all for carrying me through this difficult journey. Thanks, Matt.